Hi, I'm Dr. Stephen Olmos, and today's question is why is it necessary to take so many medications for chronic pain issues? Because chronic pain very often, when it's in the face and jaw, is often related to respiratory reasons. That means that at night there's a problem with breathing. Not necessarily apnea, but can be. That's where the throat closes. It can also be that we have nasal obstruction and mouth breathing, and that can produce facial pain. So when we have respiratory related reasons, then we have facial pain. And the facial pain gets to such a point with the inflammation in the jaw that simple swallowing is enough to produce forward head posture, adaptation from the pain from poking inside your skull every time you swallow. And as a result, neck and low back issues become problems, hip and foot problems become issues. So the longer you have a respiratory problem, the more physical pain that you have. The more physical pain you have, the more difficult it is to get to sleep. So medications are prescribed to get you to sleep. Problem is, a lot of those medications disturb your sleep, and the pain itself disturbs your sleep. And so people have awakenings, and then they have fatigue. And chronic fatigue means that likely you'll be diagnosed with a clinical depression. And so now medications are given for the depression. And the problem is that those medications tend to disturb sleep even more. So anti-anxiety meds, antidepressive meds before bed or to transition into sleep actually shorten sleep time. They lighten overall sleep, so it's more restless instead of restful. And also it decreases REM, so your ability to remember things is decreased. So as the combination of pain increases in the day, the sleep is more disturbed. Now you have more interruptions, you're more fatigued, the medications that are given are making you more dependent. More drugs are now given for the depression when the initial doses aren't sufficient. And so this merry-go-round of treating the problem in a symptomatic way, instead of looking at it from an origin standpoint, which is to address the respiratory reasons and make sure that the person can sleep through the night restfully, breathing through their nose as they should be without their throat collapsing, and making sure that the jaw and the tongue don't fall back to block these areas when needed. So these are all the things that need to be addressed. And if you have proper function and breathing and restful sleep, it's not likely that you're going to need a lot of these meds in the daytime. Because also with sleep breathing disturbances, there's a lot of cardiovascular results, hypertension, and angina. All the cardiovascular atrial fibrillation are all commingled along with type 2 diabetes. So the medications for type 2 diabetes, the medications for the heart conditions and hypertension are also related to sleep breathing disorders. Hopefully this has helped with the understanding of the interactions between all these functions. Thank you.